Hello and a very warm welcome to News Across Nigeria. I am Olumide Macaulay. On today's edition, Kogi State and Ekiti State begin awareness campaign on Lassa fever. Over 700 shops destroyed in a market in a fire in Kaduna State. And infrastructure in Edo State, the governor inspects road projects. We begin in the northeastern region of the country and the health sector. The federal government says it has concluded plans to set up 100 primary health care centers across the country within the next 3 months. Now, this is according to the Minister of Health, Professor Isaac Adewale, who is on an assessment tour of health care facilities in the war-torn northeast Nigeria. The minister says the plan is to provide each ward in the country with self-sufficient health centers in line with global best practices.
Worried by the deplorable healthcare facilities in the northeast, particularly Adamawa, Borno and Yobe states, which have been badly affected by the Boko Haram insurgency, the Minister of Health, Professor Isaac Adewale, pays a visit to the states to assess the situation. These, he says, will help the federal government plan comprehensively for the health of the people. At a meeting with the executive members of the Yobe state government, the Deputy State Governor Abubakar Aliyu puts the number of the internally displaced persons in the state at over 300,000.
I believe the visit the Honorable Minister and entourage will undertake to some of these camps and the federal health facilities for on-the-spot assessment is not only laudable but pave the way towards addressing the myriads of problems affecting the operations of these centers and reconstruction of the destroyed health facilities in the state, which include general hospitals and 5 general hospitals and 88 primary healthcare facilities.
We will pay special attention to primary care centers. We will ensure that we partner with the state government to reposition secondary care. And we also support the Federal Medical Center in Damaturu so that we can really provide the care that people need.
The minister then pays a visit to some of the internally displaced camps and health centers in Damaturu, the state capital. There he provided some relief materials and gives more assurance that help is on the way.
As soon as we go by, we'll submit a report to Mr. President, and health will soon be on the way. We will refurbish the primary care centers. We will also support the provision of ambulance service.
On the Lassa fever epidemic, here's what the minister had to say.
Well, Lassa fever nationally is occasional winds that we have blowing across the country every year. And what this administration will do is that this will be the last wind that will blow across this nation.
Professor Adewale was also in Borno State, where he was received by Governor Kashim Shettima and members of his executive. The governor says health facilities at the University of Maiduguri Teaching Hospital are overstretched. Again, the minister gives an assurance that the federal government will intervene and do things differently.
A tertiary healthcare facility overnight became a secondary healthcare facility. They were daily inundated, overwhelmed by avalanche of patients, of bomb victims that were being taken directly from bomb sites to the teaching hospital without a dime, not a dime of support from the federal authorities.
We want to adopt the same concept that the entire world has recommended, and that is putting in place one functional primary care unit in each ward in the country. And we envisage at the end of the exercise, there will be about 10,000 functional primary care units in this country in the next 2 years. As a proof of concept, Your Excellency, we shall do 3 within the next 100 days. In fact, what we want to do is we want to do 1 per day. So in 100 days, we shall deliver 100 to show Nigerians that it can be done. And that this is a government that is serious and committed to really providing healthcare services to people.
What is now left is for the government to match words with action and deliver quickly.
Now, a major concern for the states now is Lassa fever, staying with the health sector. And as Nigeria battles to curtail the spread of the Lassa fever virus, governments of Kogi State and Ekiti State say that they're making concerted moves to educate the people on how to curb the spread of the virus. In Kogi State, Nigeria's north-central region, a dermatologist with the Federal Medical Center, Lokoja, Kogi State, Dr. Joseph Gabriel, is appealing for an enhanced enlightenment campaign to make the people of the state aware, especially rural dwellers, on the need to take preventive steps against the outbreak of the virus. And in Ekiti State, Nigeria's southwest, the state government there has embarked on an awareness campaign across the 16 local government areas of the state.
It's another campaign awareness on Lassa fever virus, and this time community leaders, government workers and other health officials in Ekiti State, southwest Nigeria, travel across the 16 local government areas to educate residents on how to stay safe. This campaign is being led by the Ministry of Information to get the people informed about the virus and to prevent it from spreading.
We have done sensitization jingles in English, in Yoruba, in Hausa, in Igbo, and of course talking about the Ebiras, because we discovered that the Ebiras live in unhealthy environment in Ekiti State. So we've designed communication messages that will catch the Ebiras as well. That's number one. Number two, we've done printed materials, leaflets, posters, talking about preventive measures, talking about causes, signs, and where you can get help.
Market women are receiving soft advice from the Deputy Governor, Mr. Olushola Kolapo, who harps on the importance of educating one another on the need for a clean environment.
Ekiti State is saying no to Lassa fever. If you find ourselves in any other place, if you are a parent, when your children come back from school, educate them. When you go to the marketplace, ask your friend, have you heard about Lassa fever? This is what Lassa fever can do. This is the danger of Lassa fever. Educate him or her about what you have learned about Lassa fever.
And in the event anyone contracts the virus, officials from the Ekiti State Ministry of Health are confident of handling reported cases.
The entire health team are fully sensitized and fully prepared to take any suspected case or even infected case right from the community. We have our staff deployed into the communities on active case search, and once they see a case, they must report to the local government DSNO officer, who reports to the medical officer of health.
Meanwhile, in Kogi State, north-central Nigeria, health workers at the Federal Medical Center in Lokoja, the state capital, are being educated on detecting the Lassa fever virus and how to manage a patient without being infected themselves.
Transmission may occur, okay, that's within the hospital during any of these processes, during collection of specimen collection, sample transportation, specimen processing, as well as waste disposal.
3 suspected cases have been identified in Kogi State, one of which proved negative, while one of the patients died before the test could be conducted. Across the country, however, over 60 cases have been reported in 17 states. The reason for intensified campaigns to stop the spread.
You're watching News Across Nigeria, where we tell you what's happening across the Nigerian Federation. Coming up, in Plateau State, more birds infected with bird flu in that state. Please stay with us.